Breaking news right now, protests taking place right in or in front of Senator Mitch McConnell's office as the Senate health care bill remains up in the air. Protesters receiving their third and final warning before officers started making arrests. Here now is Bret Baier, special report host. Look, I mean, you know, normal Washington chaos. Bret, what would you say this break now, this pause that we have in the action on health care while we wait for Senator McCain to recover? Do you think it's good or bad for the chances of getting the bill done?
I don't think it's helpful, Melissa. Good afternoon. By the way, I don't think that protest is a big deal at all. There's just a few, maybe 10 people up there, and now they're making arrests outside the office. It's actually a rather common occurrence in the halls there in the Senate outside those offices. But I do think that more time doesn't help the process per se. I think that what has not been covered, though, is that, you know, there are two Republicans who are definite no's, Rand Paul and Susan Collins. There were a dozen Republican senators who were definitely no on the first version. There are some who have concerns, but there is thought that perhaps they could come around if given a binary choice of either Obamacare as it is now or this new, you know, Republican version, and then a continued promise to keep on working to make it better under the Republican guidelines, which is a more market-based approach, obviously.
So what does that look like? I mean, because from this perspective, better is better. You know, this bill is an improvement on Obamacare in terms of market forces, and I'm looking at it, you know, from an economic perspective of where the math works and how you get people covered and that sort of thing. But after that, if you're going to improve it again, what does that look like? I mean, is it more legislation? What's the next step?
Well, that's a great question. I mean, I think you have other elements that cannot be put in the reconciliation bill. For example, crossing state lines and competition across state lines for insurance companies. Tort reform can't be tackled in this bill. Not that
because of the rules.
Right, because you can only have the budget-related elements to be able to get to 50 votes, 51 votes, and not have to go to 60 votes, which is usually what you need in the Senate. Not that Democrats are suddenly going to sign on to tort reform, but there are other elements that they could be pushing for that could be tied into other bills. That's how Capitol Hill is supposed to work. That I scratch your back, you scratch mine, and you finally get to something that is a compromise. It hasn't worked like that in a long time, and what you're seeing now is a lot of pushback from different elements of within the Republican Party. Is
there anything that could be done to get Susan Collins on board? I mean, Rand Paul has made the whole circuit. I think he's so definite and maybe in such a corner, I don't know how he could possibly come back from that. Is there anything that anyone could do or tweak or change to get her on board in the last minute?
Well, I don't put anything past Senator Mitch McConnell. The Senate Majority Leader has a lot of tricks up his sleeve. They have done other carve-outs for other states. It doesn't make everybody happy, but it does, you know, sometimes soothe some of these senators about their concerns, with the promise that you're going to deal with things down the road, and that is what the Democrats tried to do. That's where Nancy Pelosi came up with, you don't know what's in it until you pass it, because a lot of the power in Obamacare goes to the HHS with these thousands and thousands of regulations. The bill is crafted essentially by the HHS secretary. They're trying to say that in not so many words, Republicans are, and that's the sales pitch they have to make in these final days.
Bret, thank you so much. That was so illuminating. We really appreciate you coming on. You answered all the questions that I had. Now I'm totally prepared. Thank you. I appreciate it. You're brilliant. Thank you.